Welcome to Monday's edition of COVID-19. We are starting the work week with a drop in daily cases from the 500 level, but again authorities are linking this fall to fewer testings this past Sunday. Meanwhile, on the local vaccination front, we are close to recording 1 million people with at least the first dose of the COVID-19 vaccine. Let's begin now with the broader pandemic coverage with our Kwon Soa. Now, Soa, do start us off then.
Sure, Sunny. We are seeing a drop to the 400s for the first time in 6 days, with 473 infections reported as of 12 a.m. And that's 70 fewer cases than Sunday. And it includes 449 domestic transmissions and 24 imported cases. And that raises the total here in Korea to 105,752, and the death toll is close to 1,750. Now, despite Monday's drop, we do see that last Monday we went down from the 400s to the 300s. So we are seeing definitely an increasing trend.
Right, and given that trend, I understand authorities here are seriously concerned about a possible fourth wave of the virus.
Exactly, Sunny. And also what's backing that concern is that if we take a look at our map now, infections outside of the metropolitan region are now inching closer to 40%, while the capital regions such as Gyeonggi-do province and Seoul, here the numbers are prevailing in the triple digits. So with that situation looking grim, officials are now considering stronger virus prevention measures, with an announcement expected on Friday on which social distancing measure rules will be applied beginning next week. And what citizens have to keep in mind this Monday is that a couple of basic rules that took effect last Monday are now being enforced with fines of 100,000 won, or roughly $89, with a 1-week grace period now over. For businesses, it can be up to 3 million won, or a little less than $2,700. Now, measures include a ban on eating at public establishments such as sports stadiums, libraries, museums, entertainment facilities. So basically almost any venue aside from restaurants and coffee shops. Also, entry logs must be kept for every individual visitor, while nightlife entertainment venues are required to use QR code systems. Now, meanwhile, according to a recent survey, around 73% out of 500 adults have responded that they were in favor of stronger social distancing measures, while a little less than 25% were against. Let's also get a check on the vaccination numbers. As of 12 a.m. this Monday, we have over 962,000 people who got at least one shot of the COVID-19 vaccination, and that number is expected to hit 1 million this Monday, that is. And let's move over to the international front now. We had the second Easter holiday amid the pandemic, and this is why many countries like France and Italy did not have a usual Easter weekend with strict lockdowns in effect. And meanwhile, Brazil is now almost at 13 million cases. And apart from these 20 countries that we're seeing here now, we have 3 other countries that have now over 1 million cases, and that is the Netherlands, Chile, and Canada, and the latter 2 having just hit that milestone in recent days. Let's also get a closer look at the daily increases. Now, serious situation here in India, with over 103,000 infections reported in the past 24 hours. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
All right, Soa, thank you for that. Right, among the high risks of COVID-19 transmission is the presence of asymptomatic patients. According to medical experts, these silent carriers may be unwittingly spreading the virus to those around them. We have more in this report.
대규모 유행으로 진행되는 양상이 점점 분명해지고 있고, 지난 2, 3월과 8월에 이어 3번째 유행이 진행되고 있다고 판단합니다.
Korea's third wave is showing little signs of abating, having started in November of last year, with the outbreak being fueled by a steady stream of asymptomatic cases.
코로나19 관련된 무증상자는 크게 둘로 나뉘어지게 되는데요. 그 당시에 무증상이던 사람들 중에 한 80% 정도는 나중에 증상이 나타나고 한 20% 정도는 완치될 때까지도 계속 증상이 없습니다. 본인이 코로나19에 걸렸다는 인식이 없이 편하게 이렇게 사회생활을 할 수가 있고, 이런 사람들로부터 코로나19 감염이 전파될 가능성이 굉장히 높아집니다.
In the case of the capital Seoul, around 30% of its daily COVID-19 infections are reported to be asymptomatic cases. Meanwhile, around 40% of those infected with the UK variant here in Korea reported feeling no symptoms at all. A similar situation is unfolding across the globe, with the US estimating that well over half of its total COVID-19 cases were caused by asymptomatic transmissions. So why do so many people contract the virus but end up experiencing no symptoms at all? New research in Singapore suggests that the secret may lie in the differences between individuals and their body's T cells and how they function.
We found in our recent study is that when you compare the T cells of asymptomatic patients with those with symptoms, the T cells of asymptomatics, they produce more cytokines like halt2 and interferon gamma, and these cytokines help. First, they block the virus from replicating, so the virus is not replicating so much anymore in the body.
There remains a comparative lack of research in asymptomatic infections compared to studies on symptomatic cases. Therefore, it remains unclear how factors like age, gender, and underlying health conditions are related to asymptomatic cases. What is certain is that despite the absence of symptoms, asymptomatic patients often have similar viral loads compared to those who are visibly ill.
증상 여부에 따라서 바이러스에 배출되는 양에는 차이가 없는 것으로 알려져 있습니다. 항체의 양이라든지 항체의 지속 기간은 증상이 없는 경우가 양도 적고 기간도 짧은 것으로 알려져 있습니다.
So can we now rely on our vaccines to stop this chain of transmission caused by asymptomatic infections? The latest news out of the US has been encouraging, with a CDC report saying that mRNA vaccines have been highly effective in preventing all COVID-19 infections, whether it be symptomatic or asymptomatic.
무증상 감염에도 충분한 효과를 보인다라는 결과를 보여줬습니다. 이 무증상 감염의 예방 효과에 대해서는 좀 더 자료가 필요하지만 증상 감염을 막는 것만으로도 질병 부담을 충분히 줄일 수 있기 때문에.
So what more can we do to break this vicious cycle of asymptomatic transmissions? Korea's response was that of early detection, with the country setting up temporary screening centers nationwide to ramp up testing, which helped identify more than 3,000 cases in the first month of their operation. The government has also emphasized, time and time again, the importance of individual responsibility in complying with all prevention rules.
감염자와 접촉한 사실이 있으면 증상 유무와 관계없이 꼭 진단검사를 받도록 하고, 그 다음에 내가 나도 모르는 사이에 코로나19에 감염돼서 무증상 상태에서 코로나19를 배출할 수 있다는, 바이러스를 배출할 수 있다는 사실을 명심하고 항상 마스크 착용을 철저히 해야 될 것 같습니다.
Up next, we're poised to join the regular afternoon briefing on the COVID-19 situation here on the local front for this Monday. Now, starting this week, as Sua mentioned earlier, those who violate the no-eating guideline are poised to face fines of 100,000 won. As part of tighter COVID-19 containment efforts, the consumption of food and beverages is only allowed at places of dining and drinking, including restaurants, cafes and bars. In other words, no eating is permitted at movie theatres, sports stadiums, cram schools and other such venues. Now, we're still waiting for the briefing to commence, so let's take a look at Korea's social distancing guidelines. In place, that is, until the 11th of April, that would be this coming Sunday. Now, the Greater Seoul area faces level 2 guidelines, while most other regions across the country are under level 1.5. Now, the ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. An exception has been granted to immediate family members, including grandparents, parents and children, with a cap of 8 in total. Now, the same goes for the formal pre-wedding meeting involving couples and their parents, as well as for a child's first birthday party. A few businesses, including movie theatres, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores, face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues and indoor standing concert places can be open until 10 p.m. here in the metropolitan region, while those elsewhere nationwide face no time restriction. And the same applies to nightlife entertainment establishments, including bars. Also, movie theatres and performance halls are being asked to leave one seat empty between patrons or parties. Sports stadiums here in the Greater Seoul area can host 10% of their capacity, while those elsewhere can host 30%. The attendance cap on weddings and funerals stands at 99 here in the metropolitan region and 499 in the rest of the nation. Places of worship are to abide by a 20% capacity here in the metropolitan region for regular sermons and a 30% capacity elsewhere. Other religious activities such as Bible study, choir practice, meal sharing and lodging remain banned nationwide. Now, we are still waiting for the briefing to start, so perhaps we can also take a look at Korea's COVID-19 numbers for this Monday. Now, as mentioned earlier, Korea has recorded a total of 473 cases on this Monday to raise our total to 10,500. I believe the briefing is about to start. We'll come back to you afterwards.
COVID-19 regular report of today. As of April 5th, we have total number of newly infected 449 local infections, 24 imported cases. At the moment, the total caseload is 105,752. At the moment, the quarantine people, we have 7,104, and 97 are in critical situations. We had 4 new fatalities, and the fatality rate itself decreased slightly, 1.65%. We extend our deep condolences to the deceased and their families. Yesterday, the details of the infections were sent out yesterday. Let me touch upon the weekly trend. Last week, we had daily average cases 483, which is 55.7 increase compared to the previous week. The daily average of import was 18, and this is in consistence with the people under 20, especially in Gyeongnam and Chungcheong. We have seen infections in public baths and entertainment facilities, and also religious groups are seeing more infections. Most of the possible routes are under investigation, and we have about 23% under investigations. And last week, new cluster infection was reported 30. Most of them were from family gatherings of 7, workplaces 6, and indoors facilities, sports facilities 4, and entertainment facilities we saw 3, and education facilities 4, and the slight decrease was seen in the critical situation patients. And last week, we saw 19 fatalities. Out of that, we had 9 who were over 80% and had underlying illness. A portion of foreigners who were infected were 8.8, which is also on a continuous decrease trend. And next, about the variant status. Last week, we have seen 537 that were under gene analysis, and out of more than 400, 22 were with variants. And the imported cases, we had 43 investigated, and out of that, 19, which is 44%, was by variant infections. And after October last year, we have 330 variants, and 230 was from UK variant, 82 South African variant, and 8 from Brazil variant. And last week especially, we saw 22 infected with variants. And out of this, 12 was related to the existing cases, and 5 from Gangseogu district were contracted with South Africa variant, and especially in Songpa-gu district and cases related to Namyangju, we have seen UK variants there. And we would like to explain on the measures from the government. First of all, the danger factor is the accumulated danger factors and infections in local areas by regions, and we are seeing more asymptomatic people, meaning that they are hidden in the local communities. So the authorities, we are giving more tests out to the people who are showing symptoms, and also we are taking preemptive measures, and we are strengthening these measures so that we can spot out these people. Also, we are in close cooperation with the local authorities so that we can strengthen the testings. Second danger factor is the ease of social distancing measures, and therefore we are seeing more people using multi-use facilities. From February, we have seen more people who are using multi-use facilities such as sports facilities, religious facilities, and entertainment facilities, and so on, especially the entertainment facilities that started their operations once again, and also the public baths. We're seeing more infections there, and also the logistics centers and call centers and telemarketing centers, also the door-to-door sales. We are seeing more infections there also, and therefore we urge people to abide by the preventive measures, and we're also going to strengthen the enforcement of the basic preventive measures. Especially from April onwards, we are expecting more religious groups and more events, especially with Ramadan, and also we are seeing more travelers to enjoy the spring weather and a lot of outdoor activities. So we are strengthening more preventive measures for these religious facilities, and we are also carrying on with the continuous quarantine measures. The fourth danger factor is that the variant virus, as I have reported earlier, we are seeing more variant viruses and infected cases with these. And the influx of the variant, we are trying to protect the domestic cases from variants. So we are strengthening the people who are coming in from overseas. For the last week, the number of cases hovered in the 500s. We had seen a lot of fluctuations, however, it is on the rise. So we should take extra care that this does not lead into the fourth wave, and therefore we should strictly abide by the basic preventive measures, face masks wearing, and also social distancing, ventilation, and washing your hands frequently. And second, we would like to urge you to refrain from gatherings, and if you can, please stay away from mass gatherings. Third, if you are eligible for vaccinations and if you are noted to go for the vaccinations, please do so. And at the headquarters, we are now enforcing a stronger basic preventive measures, and all the customers and owners of multi-facilities, they have to abide by the preventive rules. Next, on the vaccination status, we have 962,000 who got their first vaccine dose, and we have 27,000 who are fully vaccinated. And at the moment, we have more than 210,000 who are vaccinated, 5.7% who were vaccinated. And those of 75 years or older, we have seen 359,000 who were inoculated. The 1Q vaccinated people who are eligible for vaccination, we have seen more than 5%. And about the abnormal reactions, we have seen 7 new reports yesterday, making the total 10,997. Most of the cases were common symptoms such as muscle ache, headache, fever, and so on. So the analysis about the weekly status, the report on abnormal case were 0.4%, and cumulative report were 1.1%. Most of the cases were in their 20s and 30s. We have more females who are reporting adverse effects, and we're seeing a little bit slight more adverse reaction with AstraZeneca vaccines. At the moment, Pfizer vaccine, the second dose is being given out. For the Pfizer, we have seen 0.3% of adverse reaction report. And the second dose, we've seen 0.6% report on adverse reactions. Most of them were headaches or muscle aches or fever. At the moment, we are under investigation for the abnormal reactions. So let me turn the mic to the investigation team leader.
예방접종 피해조사반의 서은숙 순천향 의대 교수가
서은숙 professor at Suncheonyang Medical Center will give the explanation.
네, 지난 4월 2일 개최되었던 제5차 피해조사반 회의 결과에 대해서 말씀드리겠습니다.
Held a
먼저
meeting
사망 사례 관련입니다. 사망 사례는
on the
5건에 대한 심의 결과
fatalities. We
현재까지
investigated
분석된
5
자료를
cases.
근거로 간 질환이나 신부전 등 다른 원인에 의한 사망 가능성이 더 높고
We found that
관련성이
there are more possibilities that their fatalities were accountable to their underlying diseases such as liver problems and kidney problems. 3 are under autopsy at the moment, and after we get the conclusions, we will report on this. So for anaphylaxis, we had 3 that were reported. 1 was confirmed that it was anaphylaxis, and other 2 were not anaphylaxis.
네. 그럼 기자님들과 질의응답 시간
So now we'll go over to Q&A session.
질병청 보도자료는 추가.
Right, there was Chung Kyung with Monday's afternoon briefing. So she went into great detail about the risk factors with regard to the recent rise in cases here in the country.
Right, there were 4 main risk factors Tong spoke about. First, the silent spreaders that are prevailing in the nation, and which means people who do not show any COVID-19 symptoms of the virus. And the second was the increase in use of multi-use facilities, as well as the religious events and more traveling that started in April with the warmer spring weather. And the fourth risk factor was variants. And let's get into the details of those variant cases. There were 41 new cases found in the past week, which includes 22 domestic transmissions and 19 imported cases. So we are seeing that the number of domestically transmitted variant cases higher than those from imported cases. And there have been 12 cases linked to existing cluster infections. And for the first time, there were also community spreads regarding the South African variant. And we also had an expert after Tong speaking on post-inoculation fatalities. There were 5 fatalities, and she said they are difficult to link. It's difficult to link the deaths with vaccination, so there have been no evidence found that those two are linked, and 3 autopsy results are still underway. Meanwhile, out of 3 suspected anaphylaxis reports, one was an anaphylaxis report and 2 others were not.
I see. All right, Suah, thank you for that.
Thank you.
국내 도입 물량도 공급 지연이 나타나고 있어 이미 확보한 백신의 효율적, 효과적 사용의 필요성이 커지고 있습니다.
모든 일상 공간에서 저변을 넓히며 4차 유행을 예고하고 있는 거 아닌가 싶습니다. 지금 우리는 순조로운 백신 접종을 통한 집단 면역으로 가느냐, 4차 유행이 현실화되느냐는 기로에 서 있습니다.
Export restrictions on COVID-19 vaccines are looking to affect Korea's public inoculation drive. Now, we have more on this reality and on the current spread of the virus in today's forum. Now, in the spirit of social distancing, we're hosting our session today virtually. I have Dr. Alice Hyungyoung-Dan at Ms. Medi Women's Hospital. Welcome, Dr. Tan.
Thank you for having me.
And I also have Professor Son Ho-jun at Johns Hopkins University. Hello again, Professor Son.
Hi, Sunny. Thanks for having me.
Right then, Dr. Tan, authorities are seeking to maximize the number of people inoculated with a single dose of the COVID-19 vaccine amid supply uncertainties. Now, having said that, Dr. Tan, how do you assess Korea's vaccination plan in the wake of what appears to be a resurgence here?
Right, so let's break it down a little bit. Let's first look at the supply of vaccine that is already in our country. We have 1.1 million doses of the Pfizer vaccine that has already arrived in Korea, of which we've delivered 106,000 doses so far. What this means is we have enough vaccine in our hands to fully vaccinate 500,000 more people. If we were to start, today, that full vaccination could be done within 3 weeks. Likewise, we have 1.5 million doses of the AstraZeneca vaccine that has arrived in our country. 856,000 people have received their first dose. That means we have enough vaccine to deliver doses to 700,000 more people. And so what I'd like to do is concentrate on delivering the vaccines that we already have in our hands as quickly as possible to as many people as we can. In the second quarter, we have 15.4 million doses that are projected to arrive in our country. But when we do the math, that's barely enough to cover the 8.6 million people who are 65 years or older in our country. And so in the face of what is going on, the fourth wave, it's upon us. We haven't seen the huge spike in the numbers yet, but it has started. And so timing-wise, we were really racing against time to vaccinate as many people as possible. And my fear is we have 98% of our population completely open and vulnerable to this virus still. And so we need to do more, I think, social distancing, non-pharmaceutical measures, because a vaccine rollout is not going to be fast enough to protect us against this fourth wave unless we do a lot now to suppress it and make sure it doesn't get out of hand.
Right, and as part of such efforts, Professor Son, this effort to offer the first dose of the vaccine to a greater number of people comes amid findings by authorities here that show a single dose of either the AstraZeneca or Pfizer vaccine offers remarkable protection. Could you tell us more about this?
Yeah, so before I kind of expand upon that, I want to have the viewers be a little bit cautious in interpreting this optimistic 90% preventative estimate that's been reported by the KCDC. Of course, also in the press list, the government has specifically indicated there are some limitations with the data, especially given the early and preliminariness of the data itself we have here. So, and then these estimates, we have to think in terms of, what is the counterfactual we're looking at as a comparator group. And these are not the same type of comparator group that were evaluated in a randomized control trial. So we likely think that these estimates are very highly optimistic. But ultimately, Korea and other countries in current situation, we're in a situation, as Dr. Tan has indicated, we're in a situation where there's a far greater demand than supply that's available to us. In such scenario, we have to think about these kind of cases where, we would prioritize the first dose vaccinations over second dose. But in thinking that, we also have to think about what are the trade-offs in making this prioritization. And I can lay out a couple of factors. The first factor is, what are the main outcomes are we looking at? First is, the outcomes in terms of preventing hospitalization and ICU admission. This is more relevant in countries like in the US and elsewhere where it has a high rates of new infection. In our country, we're very fortunate to be in a situation where, although the daily new cases averaged about 500, we're still managing these patients, new patients in the hospital. And then, limiting new number of infections and then ultimately preventing death. And the second factor we have to think about is the effectiveness of the single dose vaccine. So there are a lot of good trials that have and early data that have shown the first dose vaccine definitely is giving us protection. Of course, there's a 14-day kind of initial timeline to think about to realize its effectiveness. So it's been really important for people who are vaccinated to keep to their self-protective measures with mask wearing and things like that. But there has been really good data. But also the second dose booster effectiveness is really 10 times fold in terms of antibody response. So there's really a clinical as well as population level trade-off in prioritizing a single dose. Ultimately, and then we also don't know that how long this protective effect of single dose will last. So this it's going to be further complicated, especially when we think about the limitations of producing and procuring and ultimately administering the vaccine into people's arms. So all of these factors are going to be playing a very important role in determining what is the ultimate effect of this single dose strategy.
Right, and against that backdrop, Dr. Dan, the interval between the first and second dose of the AstraZeneca vaccine has been further delayed to 12 weeks from 10 weeks. So do tell us a bit about the shift in inoculation schedule for the AstraZeneca vaccine and its potential impact.
Right, so it will have an impact, but a positive impact. In the phase 3 trials of the AstraZeneca vaccine, exploratory analyses revealed that both efficacy and immunogenicity increased when the dosing interval was increased from 9 to 11 weeks to 12 weeks and beyond. When we look at vaccine efficacy at 9 to 12 weeks, it was 72.3%. At 12 weeks and beyond, that vaccine efficacy increased to 80%. Likewise, the S-binding antibody titer increased by 40% when we compare the dose at 12 weeks, so the booster dose at 12 weeks versus at 9 to 11 weeks. So in my opinion, it would not make sense at all to deliver the booster dose of the AstraZeneca vaccine anytime before 12 weeks. And so I think this decision makes sense and it's good news.
Right, that is good to know then. Professor Sohn, Korea's second quarter vaccination plan appears to be on track, but given the current supply disruptions worldwide, what are your prospects for the third quarter?
Right, so it really depends on how the vaccine producers are able to supply these vaccines. And we know there are a lot of complications in terms of manufacturing vaccines. We've seen, first of all, one of the first factors is vaccine nationalism, right? So India has recently decided to start exporting AstraZeneca vaccine because they want to prioritize their own citizens. Same thing, I think we would have same perspective for our own citizens as well, and then the US as well. Second is that we recently saw last week that there has been contamination issues with the ingredients that are used for Janssen vaccine that are mixed against the AstraZeneca vaccine. So US is stopping all of the AstraZeneca vaccine production because they want to prioritize production of Janssen vaccine. But also at the same time, this means that any of these production problems can happen at any of the steps in the production point. So that can further delay any of the supply of the vaccine that are realized in South Korea. And then ultimately, with the vaccine supplies being short, we're going to be, having issues with, administering vaccines effectively to the first dose, second dose that we had that debate earlier. And this all coupled against with, how well we are able to administer with our given dose usage of the, low dosage, the syringe, the special syringe that are able to increase the number of doses that can be administered in a single vial. So all of these are going to be an important factor for the third quarter and beyond.
Right. Now, also in related news, amid global vaccine shortages, Russia is looking to share its product with countries in need. Now, for more on this, I have Uliana Pavlova at the Moscow Times live on the line. Hello, Uliana.
Hi, thank you for having me.
Right. Now, Uliana, I understand a number of countries have shown interest in Russia's vaccine. Do tell us more about this.
Right. So as of today, about 57 countries have already authorized Sputnik vaccine for use. And South Korea is not yet one of those countries, but it seems like South Korean authorities are open to considering Sputnik. Sputnik vaccine has been also running into some production issues. So Russia has been scaling up, and Russia and South Korea are actually working together on the manufacturing side. And Russia made similar agreements with China and India. So the production has been scaling up on the Russian side as well.
I see. Meanwhile, I hear, Uliana, a single-shot version of the Sputnik vaccine has been approved, and a vaccine for animals is also underway. Could you tell us about this as well?
Right. So Sputnik Light is a one-dose version of Sputnik, so you won't get the second shot. But actually, this weekend, Alexander Ginsburg, who's a director of the Gamaleya Research Institute, went on Russian TV and said that Sputnik Light vaccine has a 50% chance of reducing the risk of getting coronavirus. So by now, it seems like the two-dose vaccine is actually still more effective. And Russia has also been the first country in the world to register the vaccine against coronavirus for animals. And there have been tests done on minks, cats, dogs. And as we all know, there was a tragic instance in Denmark that led to a mass kill-off of minks. So if Russia can roll out a mass vaccination of animals, we can prevent some of the mutations that happen when animals get infected.
Right, that is true. Now, more on a grim note, though, more than 1,000 people, I understand, in Moscow have been infected with the coronavirus after being fully vaccinated. Uliana, what can you tell us about this unfortunate event?
Unfortunately, this is true, and I've actually spoken to some people in Moscow who got 2 shots of Sputnik and then unfortunately tested positive for coronavirus. From what I understand, their cases have been mild, and Sputnik developers have came forward and said that indeed the Sputnik vaccine protects 100% against severe cases of coronavirus and hospitalizations, but there is still a chance that you might get infected with coronavirus. So everyone has been warned to wear face masks and continue with some of those preventative measures that we have been following so far.
Right. All right, Uliana, thank you very much for making the time to join us live at this hour.
Thank you.
Right then, Dr. Dan, what are your thoughts on the idea of expanding Korea's vaccine arsenal to include those from Russia and China?
I would steer clear of any vaccine that has not been proven in rigorously performed phase 3 trials to be safe and efficacious. Basically, we need to have access to all data from phase 3 trials. We need to be able to evaluate the information that's available. Unfortunately, that's not the case for either the Sputnik or any of the Chinese vaccines. And so the bottom line is, we need full access to the data sets from phase 1, phase 2, phase 3 trials. All we have for the Sputnik vaccine is some interim phase 3 trial data that were published in the Lancet back in February, but that's it. And so the bottom line has to be, if there's no data or not enough data, there should be no deal.
I see. Meanwhile, Professor Sohn, there are signs of resurgences across the globe amid vaccine supply shortages. Now, what is your take on the current global COVID-19 situation?
Yeah, so this is a really classic example of, or case of people relying too much on vaccines, right? So we know that we have vaccines and we have several options with the vaccine. And there are, positive signs of how these vaccines are being protective. But we are also faced at the same, facing the challenge of procuring and securing these vaccines and getting vaccines into people's arms. So I think this is an important step in our time in COVID-19 pandemic and the control efforts to remind ourselves what we're still in the phase where we have to really focus on person level and overall social level protective measures that can prevent transmission of the disease from one, protect ourselves from disease, but also protect other people. And just want to remind that there's a Swiss cheese model of pandemic defense. Each layer of a Swiss cheese has lots of holes, and it represents imperfectness of each layer of interventions that we have. But when these are layered together in multiple pieces between the vaccine and ourselves, it can have significant effect. And vaccine, we have to remember, is at the end of this equation. So we have to continue with our efforts, as Dr. Tan has mentioned, with our personal hygiene, keeping ourselves with keeping our safe distance against one another. We're very getting closer to our goal of fighting the pandemic, but I think we're still not there yet, especially with all the challenges. So we have to be really mindful of ourselves and others at this time.
Professor Sohn, I love the metaphor there. And Dr. Dan, what is your assessment of the local COVID-19 situation?
Right. So in my opinion, the fourth wave is already upon us. We may not see it, we may not feel it, but it's already here. And as we heard again today, reiterated, the variants are circulating in our community. This is a fact. And so it's really a matter of what we do, how much we do, and when do we do it in terms of trying to mitigate and prevent this fourth wave from getting out of hand. The question is, are we going to just keep the high risk venues open and hope for the best? Or are we going to act early like Italy did and really try to mitigate the impact of this fourth wave? Because they acted early, Italy was able to decrease the time to the peak of their most recent wave by 2 weeks. Hopefully that will also translate to decreased cases overall, decreased hospitalizations, and decreased deaths. And so I hope that the people really heed the calls of the Minister of Health and Welfare and go back to doing the non-pharmaceutical measures that have worked successfully for our country so far.
Right. Meanwhile, Professor Sohn, as of last week, Korea has launched vaccination for the greater public, including the elderly aged 75 and above. What are your thoughts, very briefly speaking, on our vaccination progress thus far?
Yeah, so we've been vaccinating people about 37 days now, with an daily average of about 27,000 people. And I think in the context of where we are right now, we're doing pretty well. we've seen that 90% of the first dose vaccine candidates as of April 4th have received the vaccine, which is really good. But these are also, we have to be mindful that these are more in the facility-based administration, which is less challenging than administering vaccine in the general public. And in the general public, we need people's will, voluntary will, to get the vaccine when it becomes available. And we're also going to be facing with, vaccine procurement issues and shortages. So I think we are in a good place, but we have to be very cautious about optimistic outlook in the long run. So like Dr. Tan has said, we need to continue with our social distancing measures, any non-pharmaceutical interventions at this stage.
Right. And Dr. Dan, what are your words of advice for Korea at this particular point in our fight against the pandemic? Very briefly again.
So I have 3 points. First of all, if you're offered a vaccine, please take it. My grandmother died due to COVID-19 in December, even though a vaccine was available, because she didn't have access to it. I don't want the same thing to happen to any of you or your loved ones. Secondly, if you want to get out of your house for fun, for fresh air, choose an outdoor activity in an open space where you can distance, keep your mask on, and do it with only people that you're living with. Third, for the next 2 weeks, let's stick to the basics. MAD HDTV, wear your mask, avoid crowds, distance, remember your hand hygiene, test if you have symptoms or suspicion of COVID-19, ventilate your indoor spaces, disinfect high-touch surfaces. It's worked for our country so far. Let's make sure we stick to the basics for the next 2 weeks at least.
Right, Dr. Dan, do accept our sincere condolences, and thank you very much for your advice. And Professor Sohn, thank you for your insights as well.
Thank you.
Right, authorities here are warning about a possible fourth wave in the absence of complete adherence to social distancing guidelines. So do seek to do your part to limit the spread of the virus. Thank you for watching.